What is the link between constant hunger and diabetes, particularly in terms of the body's inability to absorb glucose correctly? Let's explore. Hello, health enthusiasts. Today's video is a crucial one. We're uncovering the early signs of diabetes that you should never ignore. With over 34 million people in the US affected, it's essential to recognize these symptoms and take action. Stick around to the end for tips on diabetes prevention through the right food choices. Let's dive in and prioritize our health together. Diabetes is a chronic condition that causes glucose, or sugar, levels in the body to rise. The problem is ignoring or writing off the symptoms as something else can lead to more serious health complications later on. Even if you have mild blood sugar elevations, you can damage your organs. Food is broken down into sugar and released into the bloodstream, which signals the pancreas to release insulin. There are two types of diabetes, one where a person with diabetes doesn't create enough insulin, called type 1, and another where your body doesn't respond like it is supposed to with insulin, called type 2. Number 1. Frequent urination. Frequent urination is one of the key indicators of diabetes. When there is too much sugar in the blood, your kidneys are forced to work harder to get rid of the excess sugar. The kidneys produce more urine to get the extra sugar out of the body. Needing to use the bathroom a lot can be the first indication of diabetes. Number 2. Dry mouth and excessive thirst. Dry mouth and excessive thirst go hand in hand with frequent urination. Think, it's hot, or I just haven't had enough water today. That's a normal part of life. But if it's a constant thirst or combined with the need to urinate frequently, it might be your body's way of saying that you're not producing enough insulin. Number 3. Dry skin. With diabetes, skin moisture can be hard to balance. If you notice your skin is dried out, especially your feet, look out for other symptoms of diabetes. Number 4. Repeat infections. The excess sugar in your urine serves as food for yeast and bacteria. Food coupled with a warm, moist area helps them thrive. So people, especially women, with diabetes often experience frequent urinary tract or yeast infections. Number 5. Slow healing wounds. The higher blood sugar content in a person with diabetes can interfere with the body's ability to heal wounds. This can be especially dangerous if you have undiagnosed diabetes, as diabetes can cause nerve damage. With damaged nerves, it's harder to feel when an affected area of the body has a cut, scrape, or blister. Since it's harder to know when you have a wound, you're much more likely to develop an infection. Number 6. Blurry vision or eye difficulties. Some people notice a problem with their vision, so they go to the eye doctor. After an eye exam, they learn it isn't an eye problem at all. Blurriness, vision loss, or seeing dark spots can indicate diabetes. Number 7. Constant hunger. Your body converts the food you eat into glucose that your cells use for energy. But if you have diabetes, the cells can't absorb glucose correctly, so your body can't get enough energy from the food you eat. Therefore, your body is constantly looking for fuel and you'll feel hungry all the time, even if you just ate. Number 8. Losing weight. Sudden weight loss, especially when you're not trying to lose weight, is often an indication that something isn't quite right. It could be nothing, but it could be an early sign of diabetes. Number 9. Yellow, reddish, or brown patches on your skin. Necrobiosis lipoidica. This skin condition often begins as small raised solid bumps that look like pimples. As it progresses, these bumps turn into patches of swollen and hard skin. The patches can be yellow, reddish, or brown. You may also notice the surrounding skin has a shiny porcelain-like appearance. You can see blood vessels. The skin is itchy and painful. The skin disease goes through cycles where it is active, inactive, and then active again. The medical name for this condition is necrobiosis lipoidica. Number 10. Darker area of skin that feels like velvet. A dark patch, or band, of velvety skin on the back of your neck, armpit, groin, or elsewhere could mean that you have too much insulin in your blood. This is often a sign of prediabetes. The medical name for this skin condition is acanthosis nigricans. Number 11. Hard, thickening skin. When this develops on the fingers, toes, or both, the medical name for this condition is digital sclerosis. On the hands, you'll notice tight, waxy skin on the backs of your hands. The fingers can become stiff and difficult to move. If diabetes has been poorly controlled for years, it can feel like you have pebbles in your fingertips. Hard, thick, and swollen-looking skin can spread, appearing on the forearms and upper arms. It can also develop on the upper back, shoulders, and neck. Sometimes, the thickening skin spreads to the face, shoulders, and chest. In rare cases, the skin over the knees, ankles, or elbows also thickens, making it difficult to straighten your leg, point your foot, or bend your arm. Wherever it appears, the thickened skin often has the texture of an orange peel. This skin problem usually develops in people who have complications due to diabetes or diabetes that is difficult to treat. Number 12. Blisters. It's rare, but people with diabetes can see blisters suddenly appear on their skin. You may see a large blister, a group of blisters, or both. The blisters tend to form on the hands, feet, legs, or forearms and look like the blisters that appear after a serious burn. Unlike the blisters that develop after a burn, these blisters are not painful. Number 13. Skin infections. People who have diabetes tend to get skin infections. If you have a skin infection, you'll notice one or more of the following: hot, swollen skin that is painful, an itchy rash and sometimes tiny blisters, dry scaly skin, or a white discharge that looks like cottage cheese. A skin infection can occur on any area of your body, including between your toes, around one or more of your nails, and on your scalp. Number 14. Open sores and wounds. Having high blood sugar, glucose, for a long time can lead to poor circulation and nerve damage. You may have developed these if you've had uncontrolled or poorly controlled diabetes for a long time. Poor circulation and nerve damage can make it hard for your body to heal wounds. This is especially true on the feet. These open wounds are called diabetic ulcers. Number 15. Shin spots. This skin condition causes spots, and sometimes lines, that create a barely noticeable depression in the skin. It's common in people who have diabetes. The medical name is diabetic dermopathy. It usually forms on the shins. In rare cases, you'll see it on the arms, thighs, trunk, or other areas of the body. The spots are often brown and cause no symptoms. For these reasons, many people mistake them for age spots. Unlike age spots, these spots and lines usually start to fade after 18 to 24 months. Diabetic dermopathy can also stay on the skin indefinitely. Thanks for joining us on this insightful journey into the signs of diabetes and the power of prevention through healthy food choices. If you found this video helpful, don't forget to give it a thumbs up, subscribe, and hit that notification bell so you never miss our health-focused content. Have a personal story or questions about diabetes? Share them in the comments below. Your experience might help others. Remember, your health is your wealth, so prioritize it. Until next time, stay informed, stay healthy.